My name is David Jackson. I'm a cardiologist here in Columbia. I'm the director of the cardiac rehab program here at Howard County General Hospital.
I'm Preeti Benjamin. I'm the manager of Howard County General's Cardiac and Pulmonary Services.
I'm Susie Jeffries. I'm an exercise physiologist here at Howard County General Hospital.
My name is Jim Greco, and I'm a heart transplant patient. When you're disabled through heart condition, there's a lot of factors going on that you have to deal with. One, you need to change your lifestyle. You need to learn how to eat properly. You need to learn how to read labels and to understand what they say on the foods that you buy and prepare. You need to know how to exercise. And frankly, once you've had a bad heart attack, you're afraid to exercise. A lot of people say, well, you know, exercise is what caused it. Or exercise with the bad heart is what caused it. And what you're going to learn is that your lifestyle is what caused it, or your genetic predispositions have caused it. And what you need to do is now learn how to live and work and enjoy life within the parameters that you've now got to work with. And that's what cardiac rehab does.
Cardiac rehab is twofold. First, it's an exercise program. What we found is that many of our patients are middle-aged or older, and they've gone throughout their life really not being involved in any exercise program. They've had a cardiac event, and at that point they are somewhat hesitant to do anything physical because they feel that they may have another event or they may be hurting themselves. Well, it's far from it. And so the program is designed to encourage patients to exercise in a way that's more supervised, is monitored, and we want the patients to be sure that it's safe.
They do a variety of exercises, bikes, treadmills, upper body, arm machines, weights.
So we get a broad spectrum of people. We get people who are endurance athletes and people who have not exercised for 30 years or maybe never exercised formally before. So getting them into the program 3 days a week, starting to exercise if they're that deconditioned person who have never done anything is really a new journey for them.
We see a variety of patients with zero or little fitness to patients that have multiple diseases in addition to their cardiac history. We have patients that have diabetes, arthritis, pulmonary issues, and we try to manage all of that here.
Even though I changed all those things, I had 4 more heart attacks. And each time after the coronary event, my doctors put me back through cardiac rehab because I had to relearn what my new limitations were. And I had to relearn where my safe limits were. So I think for the last 20 years, I've done as well as I could, and it's all because of the group over there at Howard County General and the good doctors and nurses that work with them.
The other part of the program is educational. People who have had an event, there are reasons why they've had an event. They're overweight, they have diabetes, they have high cholesterol, their blood pressure is not well controlled, they smoke, and so on. And so our goal is to encourage them to treat those risk factors, to understand the relationship between those risk factors and heart disease, and to encourage them to be more astute in following their disease state, to make sure that they treat themselves well after they've had their event so they don't have another event.
Most of our patients are anxious or depressed, not sure what they can do. So one of the things that we help do is we help build their confidence, and we also show them in a non-threatening way some of the lifestyle changes that they can make.
We really focus on giving them the tools that they need. So teaching them how to read food labels is probably one of the most important things we give them. As you know, the front of the package is always the enticer, and so we encourage them to turn the package over and read actually what they're getting.
One of the unique things I think about our program is the fact that we have patients coming into the program at all different times, which allows some of the newbies to get support and encouragement from some of the patients that have been here for a little while longer.
Cardiac rehab shows you how to exercise. It shows you how to exercise safely. It teaches you how to recognize your limits and how to work within those parameters so that you work safely. And they do that by monitoring you for 12 weeks and showing you literally what's too much and what's not enough. And by doing that, they instill a great amount of confidence in you, and it lets you get back to living a normal life.